Nuswantoro berdiri megah di dalam cahaya perjalanan ilmu yang menginspirasi dan menerangi. Kami sangat bangga mempersembahkan program Magister Kesehatan Masyarakat sebagai wadah di mana pengetahuan bertemu inovasi untuk menciptakan perubahan yang berarti. Bersama-sama, kita menjelajahi tantangan kesehatan masyarakat dengan pendekatan teknologi, mempersiapkan pemimpin yang berkomitmen di masa depan. Di kampus inilah, mahasiswa ditempa menguasai teknologi, bukan hanya teori yang mereka genggam erat, tetapi praktik nyata yang menjadikan mereka hebat. Visi program Magister Kesehatan Masyarakat adalah menghasilkan lulusan yang profesional dan unggul di bidang kesehatan masyarakat yang berbasis teknologi informasi dan kewirausahaan bertaraf global. Dalam sinergi yang megah, terjalin kerjasama kuat antara FKM UI, FKM Undip, Dinas Kesehatan Kota Semarang, dan PLN. Bahkan melintasi batas negara, diantaranya dengan NTUNHS Taiwan dan Split University melalui sistem kredit transfer. Diharapkan mahasiswa
Hello, good
nantinya
morning, Prof. Chen.
hingga ke
Hi,
dalam
morning. Can you see me?
Yeah, how are you?
Okay. Can you hear me?
Okay. Is my voice clear?
Yes, this is good. It is good.
Okay, we need about a half hour to wait.
Okay, no problem. Do I play my slide by myself?
Okay, you will share your slide by yourself.
Okay, I can share my screen, right?
Yeah. We have
Okay,
already created you as a co-host.
Okay.
Yeah.
Let me see. Share my screen.
We will start with pretest before for students, and then 8 AM we will start.
Is that okay? I just share my screen and can you see?
Yes,
it?
that's good. That's good.
Okay, I play page up, page down.
Yes, I could. Great.
Okay, it looks good.
As you said last time that you will select by yourself which slide do you want to share.
Okay, then I stop. Okay, now I stop sharing. Okay.
Yeah.
Okay, good.
Yeah. Okay.
So it looks good.
Just a moment, yeah. Thank you, Prof. Chen. Welcome.
Okay, yeah. And oh yeah. It looks different this morning.
Oh, because for the first time we met, I wear a mask, and now I just
probably
throw away the mask.
Okay.
Okay. What are you doing?
I'm traveling in Japan with another conference. Yeah.
Oh, okay, in Tokyo.
Tokyo. Yes. This morning I'm in Tokyo. I'm in the hotel room.
Okay.
Yeah.
10:30 in Tokyo right now, right?
Yeah.
We have two keynote speakers, and another one is from Thailand.
Oh, okay, okay.
Good morning.
Hello, good morning, Dr. Nuta.
Good morning. Selamat pagi.
Selamat pagi. Yeah. So, how are you?
I'm fine, thank you. And you?
Yes, me too.
Yes.
Welcome, yeah. We have here also Prof. Chen from Taiwan.
Hi,
Hello.
Professor. Nice to meet you.
Nice to meet you. Nice to meet you.
Better to engage each other, then we will have a new relations friend with the other university, Prof. Chen and Dr. Nuta.
Okay.
We will begin in a quarter hour, but
Mhm.
now students start for the pretest.
Okay, okay. And would you mind if I would like to share my slide myself? And I would like
Oh, okay.
place for
Yeah, that's good. We already make you as a co-host. That you already noticed that?
Yes, yes.
Yeah. So
Okay.
you are able to be to share your slides.
May I taste my video?
Yeah. Nuta, if something happens, some trouble maybe on the way, then you can just tell to your student Pla, and then Pla will contact me directly.
Can you see the video? Is the video showing or?
Yes, yes, great.
Okay.
I could see. That's great.
Okay, thank you.
Okay. Thank you. Yeah.
There's heavy rain in Bangkok right now. I'm not sure for the internet connection can be interrupted by the
Oh,
heavy
good
rains.
morning. Yeah. Oh, okay. But you can hear our voice clearly?
Yes.
Kayaknya.
Belum.
Dunia berkembang dengan sangat cepat, seiring dengan itu datanglah tantangan baru dalam menjaga kesehatan masyarakat di tengah revolusi digital. Teknologi informasi menjadi kunci untuk menghadapi tantangan itu. Selamat datang di program studi kesehatan masyarakat Fakultas Kesehatan Universitas Dian Nuswantoro. Kami adalah program studi yang terakreditasi A dengan visi menjadi program studi pilihan utama di bidang pendidikan kesehatan masyarakat yang berbasis teknologi informasi dan berjiwa wirausaha.
Slide just to make sure that the connection is good. Could you?
Yeah, you mean I share my screen?
Yes. Just to make sure.
Hello, good morning. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi
Good morning,
wabarakatuh.
everyone, ladies and gentlemen. Welcome to the international guest lecturer about Global Health and Environmental Issue from Faculty of Health Science, Dian Nuswantoro University. I also would like to greet the honorable speakers, Professor Xian Yeshu from Taipei University of Nursing and Health Science, and Associate Professor Nuta Supakata from Environmental Science Department of Chulalongkorn University, Thailand, the Honorable Dean Faculty of Health Science, Secretary of the Dean, all of Head of Study Program, all lecturer and staff in the Faculty of Health Science, Dian Nuswantoro University, and also all my beloved students. First of all, let us pray and praise to Allah Subhanahu wa Ta'ala because of His bless and mercy. We can come together without any obstacle here with healthy condition in this agenda. Well, to take advantage of the time, let's start this agenda by reciting Basmalah together. Bismillahirrahmanirrahim. Okay, let me introduce myself. I'm Izatul Alifasifai as your host for today. And the next agenda is singing National Anthem Indonesia Raya, will be led by the committee. For the committee, the time and place are yours. Okay, ladies and gentlemen, we are now in the opening session. Without further ado, I would like to invite the Dean of Faculty of Health Science to give welcome speech and also open the event. To Ibu Eni Rahmani, SKM, MCom PhD, the time and place are yours.
Thank you. Can you hear my voice? Can you hear my voice? Okay.
Yes.
Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. honorable speaker and also guest, Professor Chin Yesu from NTU NHS, and also Associate Professor Nuta Supakat from Chulalongkorn University, and also Honorable Vice Dean, the study program, also lecture from Faculty of Health Science, also our beloved student from Faculty of Health Science. Let's praise to Allah Subhanahu wa Ta'ala that we have meet together in this happy occasion, that we can get a sharing from another country related global health issue and also the environment. Understanding global issue is very important for us, that we active in health sector, because in change behavior and human, we have many environment issue, and also since COVID-19, we have issue in related big data. So I'm very pleased and also thankful for the speaker that willing to sharing the experience, also the knowledge for us, for Civitas Academy of Faculty of Health Science. I hope in this seminar, in the guest lecture, we can get important message for all of us, that in the future we can improve our research, our understanding related global health issue or for environment. And for the student, in the future, we should make notable in the global area. So we are Faculty of Health Science, try to introduce all of you that we invite many speakers from another country. So all of you get insight from global university. So the competency of student in Faculty of Science can improve a lot. So after you graduate in Faculty of Science, you can get a position. Also, maybe you can prove yourself that you have confidence to get job in another country. We have one student get to already went to Taiwan to continue the study from NTUS, that maybe all of you also can follow the same track. So we starting from the first semester to exposure you another issue, another knowledge from another country. I think that's all. With Bismillahirrahmanirrahim, I open the guest lecture from NTUNS dan Chulalongkorn University. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Ibu Eni Rahmani, for the warm welcoming speech. And before we move to the next agenda, let's take a photo together to commemorate this moment. So everyone, please open the webcam. Yeah, I will wait everyone here to open the camera. Okay. For the committee, okay. The first slide. 1, 2, 3. Okay. For the next slide. 1, 2, 3. Okay. It is okay enough? Okay. Okay. Thank you, everyone. And I would inform to you all that it was very amazing to see such an enthusiasm of the participant. So actually here we have almost 1,000 participants and divided into 2 Zoom platforms and also some participants in YouTube. And now, ladies and gentlemen, now we come to the main agenda. There will be two speakers. The first speaker is Professor Chen Yeshu from Taipei University of Nursing and Health Science. And the second session will deliver by Associate Professor Nuta Supakata from Chulalongkorn University, Thailand. And for the first session, will be Professor Chen Yeshu will deliver about Taiwan's medical information system. And Ibu Dr. Nurjana, SKM MKes, will lead the session as moderator. Okay, before we start the first session, let me introduce our moderator. Dr. Nurjana is a lecturer in Public Health Department in Faculty of Health Science and also the Secretary of the Dean. And Dr. Nurjana received her doctoral degree in 2022 in Gajah Mada University after finish her research about media literacy for smoking behavior prevention in pre-adolescent. Her field of expertise is in health promotion, especially in tobacco control. She has a wealth of research, public services, publication, and invited speakers in many scientific events. With this expertise, she's developing literacy media for smoking prevention in adolescents. And she has also done a lot of advocacy to the government regarding cigarette policies, especially for the regulation of smoke-free areas in Central Java province. And recently, she worked with research group on behavior change and communication in physical literacy. Without further ado, please welcome our moderator, Dr. Nurjana SKM MKes. Hello, Dr. Nurjana. Good morning.
Hello, good morning. Hi.
Okay. Okay, so the time and place are yours.
Yeah, thank you, Bu Ivo, for the nice introduction. Good morning, everyone. It's my great pleasure to welcome you all to today's lecture on global health. And we honor to have a distinguished speaker with us who is a leader in the field of health informatics. Good morning, Professor Chien Yesu.
Good morning.
How are you? How are
Morning.
you? Yeah, yeah. You told me that you told us that you are in Japan today.
Yes, I'm
Oh,
attending another conference in Japan, in
oh,
Tokyo today.
okay. Thank you. During your busyness, you still give us opportunity to hear your lecture. Thank you very much. And
No problem. No problem.
okay. And I will read a brief curriculum vitae. Actually, the curriculum vitae is so long, but we will read a brief. Yes, Professor Chin Yesu is a professor, currently is a distinguished professor and chairman in the Department of Information Management and at National Taipei University of Nursing and Health Sciences, where he also served as the director of the Computer Center. He holds advanced degrees, including a PhD from the Ohio State University in Speech and Hearing Science and a Master in Electrical Engineering. Professor Su has been deeply involved in promoting medical informatics in the Asia Pacific region. He is the currently president of the Asia Pacific Association for Medical Informatics, APAMI, and a fellow of the International Academy of Health Science Informatics. His past experiences spans multiple organizations, including serving as an adjunct professor at Taipei Medical University and as member of various boards related to e-health and medical informatics. Professor Su expertise includes medical records, hospital information system, and the application of cloud computing and blockchain in healthcare. Today, he will share his insight and knowledge on the topic
of trend in the use of telemedicine by NHI in and after COVID-19 pandemic for healthcare and big data. So please join me in giving a warm welcome to Professor Su. Please, Professor Su, the screen and the time is yours.
Okay, thank you, Professor Nujena, for introduction, and thank you the invitation from the Dean of Faculty of Health Science, Professor Annie, and for the international guest lectures today. And also I have a lot of friends in Indonesia, so yes, I would like to say good morning and hello to all my friends in Indonesia. Okay, so so my voice okay? I mean, everyone can see my voice, can hear my voice, right?
It's okay. It's okay, bro.
Okay, so
Yeah.
let me share my screen. Okay, so now is my screen. Is that okay to you?
Yeah, it's clear.
Okay, so I think today I'm going to talk about the health insurance in Taiwan, and also how well some in the COVID-19 pandemics the national health insurance use the big data to handle this pandemic, and also I'm going to discuss what the current big data project in Taiwan. So and also some related to the telemedicine. But I mean, we have lots of topics. But anyway, we do have a lot of chance to discuss with each other. Well, I need to apologize if we don't have time today. We can discuss more later. Okay, so that is my topic today, and I'm also from those are my I join a lot of association and lots of universities. Okay, okay. First of all, I would like to say something about it is an advertisement. I would like to announce the Med Info 2025 will be in Taipei, Taiwan next year, from August 9 to 13 in Taipei, and I will welcome all of you to participate in this conference, and maybe possible to send your paper to MedInfo 2025. The deadline for the paper submission is at December this year. So please do join us in this major conference in the world, MedInfo 2026. Okay. All right. First of all, I would like to review Taiwan's medical information system a little bit. Here is the Taiwan. We are a small island. We well, I think Indonesia is a big country, and you have 1,000 islands. We don't have that many, but that is Taiwan. We have a major feature of the national health insurance. I need to say a little bit about our national health insurance, because today's topic is about the NHIA, National Health Insurance Administration. We launched in 1995, and it is a universal coverage, which is also comprehensive and uniform benefit, limited freedom of choice, easy access, and timely and almost no waiting list, acceptable quality of care, and under affordable cost. The cost is about like 5% of our income, and the satisfaction is kind of high in Taiwan. And also, the national health insurance plays a very important role in the IT adoption of healthcare in Taiwan, because we need to send the information to national health insurance from almost all kinds of healthcare giver, hospital, pharmacies, and the clinics. Okay, first of all, you can see before we launch the national health insurance, we have in 1995. Before that, we do have several nationwide health information network project, NHIN. It started quite earlier in 1988 and also 1998, which is during the first phase of our NHI National Health Insurance. So you can see most of our project we did in that period of time to do the network and connection. You can see those projects are nothing but the network and the connections. So that means we think the data are the first priority, and if we want to transfer the data, if we want to link the data, want to collect the data, the internet connections are the first priority. So before NHI and after NHI and during the NHI, the networking are the first priority. You can see all the project we have been doing. And also currently in 2008, we have the so-called National Health Informatic Project. And after that, we have a cloud. So a lot of cloud has been building in this period of time. So the major trend of medical informatics, digital health is based on data. So you can see what I want to say is that we need to digitize everything. Okay, there are several steps from the digitization. Okay, virtualization. That means we use computer, right? So we need to digitize everything. All the people start using computer system to take care of patients. Or we can say it's paperless. Okay, we reduce the use of paper. So after that, we have integration, aggregation. That means we need to integrate all kinds of systems inside hospital. For example, we need to integrate our physician order entry system with this pharmacy system, and also the laboratory system, and the imaging, okay, radiology system. So our system in the hospital need to be integrated so that the information will be transferred freely from one department to another. So, okay, digitization, integration are the first steps in the hospital. And after that, we will have this so-called standardization and exchange. The purpose of the standardization and exchange is to share the patient's medical record, the EMR, electronic medical record, in different hospitals all over the area. So the patient's information can be shared between different hospitals and transferring from one hospital to another. So, which is very important period in Taiwan. We have hundreds, 500 hospital and more, about 20,000 clinics. The patient goes to different hospital. They need to the patient's medical record need to be shared and be reviewed by the different doctors in different hospitals. So exchange and the standardization of record are so important. So after that, we say the intelligence means we are going to use the patient's medical record to do the smart healthcare, which is finally and today also we call this technology-based healthcare. So let's see a little bit about the health system. Well, some people from the government is that we have Taiwan's one of the best healthcare system in Taiwan, and we can also see the mission of Taiwan's national health insurance is to provide universal coverage and guarantee equal access to healthcare services. So everyone pay a relatively low and affordable amount of money. We can choose any suitable hospital we wish, and doctors we prefer to get the right medicine. And also, a government issue an IC card for everyone. That is the key for us to access our data, of course, in the future. Okay, there are other publications say in Taiwan we do have a very good healthcare systems. So some very simple data from Taiwan's health delivery system. You can see most of the Taiwan's hospital are private. You can see these the public hospital only covered about 30%. Okay, and the 70% of hospital in Taiwan are private. But anyway, it doesn't matter public or private hospital in Taiwan. We are all covered by the universal national health insurance. So we almost pay equally to different hospitals. It doesn't matter it's a public or a private hospital. We pay almost the same. So this is a kind of important slide for the connections we built, which is a virtual private network for the national health insurance used only. There are several basic cloud. You can see from here the pink one is the hospital, pharmacy, clinics cloud. They are sending information to the blue cloud. Blue cloud there's a so-called IDC internet data center in the National Health Insurance Administration. Okay, they receiving data every day, every hour, every minute, every second from the hospital and the pharmacy and the clinics in Taiwan. So that is the what we built since 1988 till today. So all the data are connected, okay, to the IDC. And the National Health Insurance, they do have several local office in the central and north and south and the east of Taiwan. And the other cloud is the yellow one, which is the government cloud. Many departments of the Ministry of Health are also connected to the IDC through a so-called service center, SC. So the SC, for example, the CDC, the Center for Disease Control Department, they can collect data from the IDC very fast, and all the data will be accessed by the CDC. So CDC will know exactly what is happening in Taiwan. What, for example, is a COVID-19 or other pandemic season. Those patients go to see the doctors, go to the clinics, and the CDC will know exactly what is happening in Taiwan, different area, in different city. Actually, the IDC, they do have a very powerful computing system. The computing system will collect the data and integrate it to a personal level. That means in a few hours, okay, maybe half day or hours, your data will be collected and integrated into a personal level. So CDC will identify to a single patient's level to know what is happening to this patient. Especially, it is very helpful in a COVID-19 period. In that time, the CDC controls all the patients who is diagnosed or who is potentially diagnosed as COVID-19. So in that period of time, these networks plays a very important role in Taiwan. So this is a system we built years ago. I believe I went to Indonesia's National Health Insurance Administration. I visit them, and I think you are also building very similar connections, and also you are also collecting a lot of data today. So yeah, very similar to our the Taiwan systems in your country. So you can see this is basically the idea of the national health insurance. Okay, this is NHIA. Yeah. So the NHIA issue a national health insurance card to the population. In Taiwan, we have 23 million populations, and we, as the patient, we need to pay the premium to the NHIA. Also, in the providers, healthcare provider, hospitals, they provide services to the population, and we, as the patient, we pay the co-payment to the hospitals. And the hospital are sending claims data to NHIA, and the NHIA pay the reimbursement back to the hospital. So that is the architecture of the national health insurance in Taiwan. So I would like to mention that because we are sending a lot of the hospital are sending a lot of data, right? Like this, all the data are sending to the NHIA. So that means the NHIA do collect a lot of data from all over the Taiwan. Okay, so they also created here a so-called National Health Insurance Research Database, NHIRDB here. So the NHIRDB, the NHIA has been collected the data for more than almost 30 years. So the data here, we can, for the researcher and the scientist, you can go to apply to use the data to do your research topic. So this is very useful research database. I am one of the user, so you can apply to use the data if you are interested to do some kind of research project. You can use the data to do it. Okay, but because the data, including all the like treatment, diagnosis, laboratory, even the imaging report from the whole population of Taiwan's people, So it has become a very useful data set for the research in public health, in medical informatics, in all kinds of research. And those research databases also include the cancer registration. So that means that it's very powerful tools you can use for your scientific research. Okay, that is just the insurance card I mentioned. Okay, this is for the healthcare professionals, and here on the right hand side is for the citizens. We do have everyone got covered by national health insurance. You will have this chip card for the NHI. Okay. Oh, this is the very old one. At the very beginning of the NHI, the first several years we used the paper-based. Well, if you are interested, it looks like this way. It is before this one are issued. Okay, before the chip card are issued. It is a paper-based. We also we use the paper-based for 5 to 10 years. Okay, those are the data we store on the chip. Okay, well, not very special, just all kinds of information we need to do the national health insurance. A very special one is that at the bottom you can see if you are willing to donate your organs, in any case, well, you cannot behavior by yourself. Then if you are really want to donate your organs in that time, if you are registered as donation, then they will help you to do that. Okay, this is a typical doctor's office. Okay, we call it the dual card system. Okay, the card reader is here, and we have two cards. Okay, one is for the doctor's card, and on the top is the patient's card. So the patients need to put their card, and the doctor's card will be always there for the doctor to retrieve patient's medical record. Okay, so our plan is to establish a national electronic record and a medical imaging center, and everyone has his own electronic medical record, and also the electronic health record must be patient-centric, patient-initiated, and patient-owned. And after that, we build a lot of cloud in healthcare. You can see, for example, the prevention and the healthcare service cloud. For example, the medical service cloud, which is used by the hospital majorly, and also the rehabilitation and the follow-up services. So for the acute healthcare, for the long-term care, and for the prevention healthcare. So we build a lot of cloud to do the services and to collect data. And of course, you can see in the center, we have the health data analysis and the feedback cloud. So we collect the data, and also we analyze the data, and then we try to feedback to the hospital, feedback to the Ministry of Health, to tell them how to make decisions for the policy. Okay, so so there are several data I would like to share with you about the NHI in Taiwan. This one is the revenue and the expenditure trend. You can see sometimes when the expenditure is much over the revenues, that means the NHI was facing the bankruptcy. So in the period of, for example, in the early 2000s here, so we need to adjust the premium rate from 4.25 to 4.55. So that will prevent the bankruptcy of our NHI. And also in this period of time, okay, and then in this period of time, okay, the blue color, the revenue is higher than the expenditure. So in that period of time, okay, it's about 2013, 2014, we reduced the premium rate, okay. So it is the dynamic change, modification of the premium rate of NHI to maintain the balance of the revenue and the expenditure. Okay, you can see that. Also, from this one, you can sorry. Okay, from this one, you can see the use of the data from the NHI. We can also see the cost of the NHI, which you can see a lot of cost is from the imaging part, the CT, MRI, okay, which is much higher than the diagnosis from the physician and nurses. So, and also the drugs are in the middle. So sorry. So we need to find some way to cut the cost spent by the imaging and also the cost from the drugs. So those are the two major costs from the NHI. Okay. And here, the nurses, the salary is not the major part, of course, because you can see the red color, which is not the major part of the cost of national health insurance here. All right, so not just that, the NHI also built several clouds. They call this the Medi Cloud, which is the cloud to share our all the data of the patients. So in different hospital, you can our patient's medical record will be shared to different hospitals. We call this Medi-Cloud system. And also My Health Bank, which is the data can be also shared by the patient. So the people can also download your data, your clinical data from NHI so that is so-called the patient-centric, patient-owned medical data. And also we build a lot of AI applications for the patient to use. Basically try to focus on precision medicine and healthcare. Okay, so medical imaging report and the laboratory tests and claim data, all kinds of data we put together to form a so-called NHI Big Data Center. So because the national health insurance is using data to create efficiency and save money. Okay, so that means the NHI use the data to monitor all kinds of expenditure from individual hospitals. So all the hospitals in Taiwan also need to create information system to collect and analyze data. The purpose is we don't want we do want to reduce unclear deletion from NHIA. So that is very important. So if the hospital does not take care too much about the data they send to the NHI, they may face a major problem of deletion from NHIA. So they lose money from hospital.
Yeah, Professor
Yes.
Su, I'm sorry. Maybe you can make it in 5 minutes, or 5 or
quickly.
10 minutes. Yeah.
Okay, yeah, okay.
Yeah.
So let's I think we discussed enough, so I don't want to say too much about the history. So here are the two major services provided currently. So using the big data, they provide so-called as a MediCloud. Okay, MediCloud here used is for the healthcare professional to use. So all the doctors in Taiwan can review the patient's medical record using the MediCloud system. And another one is My Health Bank Book, which is for individual patient to use. So everyone, as an individual patient, we also can have our own data in your hand. So that these two systems are the major one in Taiwan. And okay, I also want to share with you. There are many of regarding the telemedicine. I think we can talk about that next time. So how it's good for the telemedicine in Taiwan. So especially for the COVID-19 period, we use COVID-19 we use telemedicine a lot in that period of time, and also the telemedicine also depends on data. So the doctor need to see your data using the MediCloud, and the patient can review their own data using the My Health Bank. Okay, I'd like to move to the next steps. Currently, we are following the big data's procedures. I would like to share with you those integration of medical clinical database. These are the current project. We call it digital infrastructure gateway to health data. Okay, we will launch the gateway to Taiwan's for precision health, which is the major project I am working with Professor Yang Yixin in the National Institute of Cancer Research, National Health Research Institution, Taiwan. And I would like to share with you, we try to from the doing like from the traditional library to a human readable to encodable and computable library, which is so-called mobilizing computable biomedical knowledge. So using the data to create useful knowledge for biomedical. So a very some kind of complicated data management and data governance architecture we designed for the future to use. It is not launched yet, but we need to design this kind of how the data can be used, how the data can be managed, how the data can be custodian. So a very careful design of the data governance we are doing now. And the gateway to health data, so you can see there are several steps. We have data retrieval procedures for the user. We have data sharing in the trusted environment. And finally, we need to make sure the data is verification and the validation, the quality is high enough. So our vision is to mobilize in the biomedical knowledge to serve the learning and the knowledge need for the participant, and then to ensure that knowledge can be trusted and to improve research and the healthcare for the research, and the making a gateway is a findable, accessible, interoperable, and reusable to all the needed. Okay. Finally, we have 3 steps, which is the Data Custodian Alliance. We are building this kind of alliance so that in Taiwan, all the data providers will be in this alliance so that they agree to share their data. Secondly, we need to have a research consultant team that will help the data the user to use the data, how to find the data from the data alliance. And finally, we need to have an innovation gateway and the collab, which is the team to to help people to create an analytic tools to help people to analyze the data and to create a useful data for the people they are interested to use the data. So Alliance, the consultant team, and the innovation teams are all three major part in our currently projects. Okay, so I think because of time and I think finally we will create a Taiwan Gateway to Health Data. This is the link. If you are interested, you can type this very simple one, the gsd.taiwan, which will lead you to the Taiwan Gateway to Health Data. Well, it is not ready to use yet, but in the future, we hopefully we will share the data to the world, and we are also very important. Welcome Indonesia people to share their data to this platform. You don't need to send your data to the platform. We just need to know if, for example, we do in Indonesia, you do have a very wonderful health insurance data for several years. Then we can share the data together. We can find those data, and in the future, if both of the department are agreed, we can do the scientific research using both the Taiwan's data and also Indonesia data. I believe this will be a very, very wonderful scientific research project in the future. Okay, I think that's I will end here. I'm sorry. Maybe we have next time we can talk about more about how to use the insurance data and the big data topics. But today, I'd like to share with you about the HIA, and also we are building big data for that. Okay, thank you very much. I will stop here for the questions.
Okay, thank you, Professor Su, for your very interesting and wonderful presentation. And it's maybe very useful for our students in learning the Taiwan experiences in running the healthcare system. And your presentation, maybe I can make a little bit emphasize from your presentation. Like yes, Taiwan is start the national health insurance for more than for about 30 years, and in Indonesia just starts for 10 years. But we have a lot of problem here because the huge population of Indonesia and the disparities around Indonesia. Yeah, maybe student can also asking question about how we can face the disparities. And then you also mentioned about how the cloud computing used very useful for interoperability for healthcare and also for telemedicine. And in the last presentation, you also said about the integration of integration of medical therapy in precision health. It's, I think it's very useful for ensuring the quality of healthcare. And then you also tell us about the Taiwan Gateway to Health data. It's very interesting. Very interesting to make a research, yeah, in for the next research in the pooling data with, from Taiwan or also from Indonesia. So now we open for question and answer. We open for the participants. Here we also have like more than 40 students here. Most of them are bachelor degree in public health. And we also have master's degree students in public health and in medical record and also in environmental health. So for the participants, if you want to ask the question, please raise your hand or you can type on the chat box for a question. Please, is there any question?
Okay, I think first of all, I saw some of the people, the participant cannot see very clearly with the slide. I think my slide is shareable. If anyone need to
Okay.
my slide. Yeah, I'm sorry, I do have put a lot, but you can read my slide regarding
Yeah.
another information and.
Okay.
And if you need, well, I think I would like to share with you more times, not just today. We can discuss more in the
Okay.
future.
Okay. Okay. We waiting for the question from participant. Maybe we can share from Indonesia. Yeah, as I told before that we experience for national health insurance, universal health coverage for 10 years. And now our members is about 90% of our population. Our population is about 280 million people. It's a very a good achievement. But the problem is many of NHI member, National Health Insurance member, cannot pay the cost, cannot pay. I mean, cannot pay as a member because some of them is informal worker. So how Taiwan can face like informal worker? How to collect the payment for informal worker?
Yeah, I know. Well, it is step by step. Okay, it's always step by step. Well, before the national health insurance, we do have different insurance, healthcare insurance for different group of people, like the farmer, the worker in the factory, and the teachers, and they have different health insurance. And also after that, they are poor people in Taiwan. They are not affordable to pay, right? So the poor people, we do have the government do have a project for people who are unable to pay the money. They do have a project for that. So if you are satisfy some of the qualification, and the government will pay the premium for you. So under some conditions. So yeah, you need to do that. So, but anyway, if you have a work, okay, it most of it depends on the job. If you do have a job, you work, and you work for the company, then the company need to pay. But if you are working for yourself, then you need to satisfy some of the requirement. If they are satisfied, the government will pay the insurance for you.
Okay. Yeah. Yeah. For poor people, government also pay for the membership of the US universal health coverage in Indonesia. It's also the like maybe 20% of the premium is paid by the government. So is there any question from the chat box? Is there, yeah, someone raise hand? You can ask the question by open
Yeah,
your
I think
mic. Okay, Cindy.
Cindy,
Cindy,
yes.
yeah. Yeah.
Hello, my name is
Hello,
Cindy
Cindy.
Corbin. Thank you for a very interesting presentation about health system in Taiwan. In Indonesia, we still face the health service quality, such as long waiting time. My question is, how is country like Indonesia, with disparities between areas in Indonesia, can improve the healthcare system? Thank you.
So you are talking about the waiting list. Yes. Well, that is similar, like just like I mentioned, before the national health insurance, we have different health insurance group. Okay, so if you pay more, okay, you probably don't need to wait. If you pay less, you probably need to wait very long. So
Yeah.
so that's why Taiwan, we launched national health insurance in 1995. It is very difficult decision. Well, in Indonesia, well, I'm not trying to tell your government to do this, but in Taiwan, it is very risk decision. I need to say that because the national health insurance, we pay equally. Everyone pay equally to get healthcare services, which is also a very risky decision for our nation. That means it doesn't matter you pay less or you pay more. You pay equally so that you will go to the hospital. It doesn't matter how much you pay. Your waiting list is the same. So that will reduce your waiting time because you pay equally. You no one pay more, but of course you are so much. If you are very rich people, okay, very small one, then that is another story. We don't care about that. But if you are so poor, you can go to the hospital, no waiting list. That is the risk, our decision. We want to help the poor people. So those people, many people, just like a normal citizen, they can go to the hospital and a little bit payment and no waiting list. So and why I'm saying that it is risky, because we need to make sure the level of the healthcare services. We need to promote the level of care service to a level. So before that, this is too risky to do the NHIA. So just like Indonesia, I think it's gradually, you don't need to do this very fast. Okay, step by step, we do this just like I said, now we have less than, maybe we'll go to the 20% for the NHI. And we go to the 30%, and we go to 35, and then we go to 40, just like in Taiwan. Okay, we do have a lot of health insurance. Government, okay, for the farmer, for the worker, for the teacher, for the nurse, for the what, for different people. But one day we decide, okay, we don't want that. We want one national health insurance. Then one day, okay. Maybe in Indonesia, I believe in 10 years, you will go to that, you will reach that level. So today you go percentage, and then until one day you go. So everybody should receive the same services. That day you do the national health insurance 100%. So before that, you do gradually.
Okay, thank you. But I hope we don't want to wait until 10 years. Maybe we can go soon, like yours health services maybe, yeah. And now we have many students raise hands. Maybe in the turn for Farah Rizky. You can ask the question directly for Farah.
Thanks for your time for open me question and answer. Okay, let me introduce myself. My name is Farah Rizky from undergraduate student 5th semester of Public Health Science. This is my question. In Indonesia, we face the double burden of disease, but now the non-communicable disease such as cancer, hemodialysis, diabetes make the cost of healthcare become high and high. Is Taiwan have the same problem? By the experience in Taiwan, can you tell me how Taiwan can solve this problem?
All right. So, okay, thank you for the questions. Yes, well, there are two things we need to do. Okay, the first of all, we need to create the government. Usually, they create some project to, especially for those like diabetics, for hypertension, for cancer. So even for TB, tuberculosis. So they do have a lot of different project based, not just the National Health Insurance. They do have project based to handle those problems. So that of course combined with the National Health Insurance, if you are diagnosis as diabetics, of course you are covered by the National Health Insurance, and you probably will join to other healthcare management project. So in that project, you will be managed more carefully, and especially for the data. So second, okay, first of all is we need some kind of project. Secondly, that is the data, because okay, those data, this long-term disease, okay, for diabetics, right? This is long-term. So we need to make sure your data is monitored in a very long period of time. So maybe 20 years, maybe more longer than 20 years. So those data become so important. So you need to have a system to collect, especially for the patient's data. For example, diabetics, you need to collect more data, not just the hospital's data, not just the medical record. Maybe you need to take care of these patients more carefully to monitor their data, maybe like every day. Okay, some project in Taiwan, you need to measure the patient's blood pressure. You need to monitoring the HbA1c every 3 months. So that the data will be reported to the project. So then they will know your status, so that the doctor will know the patient status based on data. That is why I mentioned so many times. The data is also very important. It doesn't matter you transfer from one hospital to another. The data need to go with you. Okay.
Okay, thank you, sir.
Okay. Okay, thank you for the response. Yeah, data is very important for make the people can have the good healthcare, and also for maybe for prediction, yeah, Prof. Yeah, for prediction and prevention, we can predict how the disease can prevent the advance of the disease status maybe. Okay, we go to the next question from maybe from the boy, Yefta Pascal. Okay, Yefta,
Oh,
can
Pascal.
you open your mic? Yeah, Pascal, yeah.
Good morning, sir. Let me introduce myself. My name is Irta Pascal from the Department of Medical Record and Health Information. I want to ask you, are there any problem when you using electronic medical record? Then how do you overcome this obstacle? Thank you.
Can you repeat that question? It is not very clear.
the question about electronic medical
very
record.
good.
Maybe still the
Uh,
problem here. Electronic medical record.
Okay.
Is it
Are there
Electronic
any
medical
problems
record.
when
Okay.
using
Uh,
the then how do you overcome this obstacle?
okay. Well, anyway, if you are asking about EMR, okay, just like several electronic medical records in Taiwan. Remember I mentioned they are digitization, integration, standardization, and intelligence. So start from the very beginning. Okay, we digitize everything. So we collect the data, we put together in the hospital using your own in hospital, right? Inside your hospital, you have your own information system. So you need to integrate the patient's data. That will become your medical record, electronic medical record in your hospital. Okay. So the importance is you need to digitize and you need to integrate your system. So all your system in your hospital can talk to each other. That will make a good EMR. However, if you want to share your EMR with other hospitals, you need to do the standardization. Okay, talking about standardization, I think today everybody talk about HL7, right? Some kind of standard provided by HL7, FHIR, FHIR, DICOM for the imaging, right? There are many standard format for your EMR to follow. That is for different hospital because different hospital using the different hospital information system. So we cannot force our hospital to use the same information system. So we need to build the EMR in the data layer. Data layer. So there are different information systems for different hospitals. But we need to build some kind of EMR above that. The EMR is a standardized EMR, which can be shared inside the hospital and also outside the hospital, especially the lady just asked about the long-term care, right? The hypertension, the diabetics project. So those data need to be shared outside the hospital. So inside the hospital and also outside hospital. So you need to make your EMR standardized for Indonesia and then in the future for international. So this is a long way to go in Taiwan. I'm doing from this project since I'm a young professor, and today I'm going to retire soon. I'm still doing the EMR. Okay, people is laughing at me. Professor Xu, you are always doing EMR. Yes, that is what I'm doing. So it's a long way to go. Okay, you want to do the medical record, electronic medical record. You need to digitize, integration, and standardized. That is a long way to go. I'm not sure I answer your question, but you look very young. So yeah, very good. You can do this project for your whole life. Yeah, no problem.
Yeah. Okay, so your challenge, Achal, I think, your challenge to be the professor of EMR, like Professor Su. Okay, the next two question, maybe you can, for Aini and Elizabeth, can you do your brief question, Aini and Elizabeth? Aini, can you open your mic, and then also Elizabeth? Maybe the two of you can ask the question after. Yep.
I guess
Ayo.
me. Let me introduce myself. My name is Aini Mustafida. I'm from the Medical Record and Health Information Study Program. Allow me to ask, how long the government need to develop digital health transformation in Taiwan?
Okay.
Sorry, comment.
How long
what?
the government make digital transformation, Prof?
How
How long the Taiwan make digital transformation?
Oh, how your question is how long? You mean how many years?
Yeah, yes.
Well, actually very long. Just like I said, before the NHI, before we launched the NHI in 1995. Okay, before that, starting from 1988, we have a project to do the connection. Remember that in my slide? So start from 1988. The project we did is to try to connect, to build an infrastructure. So in the future, we were sending data on the network. So from 1988, I will say here today, we are not finished the digital transformation yet. The government say, well, of course, we do have the MediCloud. We do have the My Health Bank. I think just like Indonesia, you are doing the same thing. So we do have the MediCloud to share the data, to share the patient's data. And if you want to ask what exactly the time, I will say that starting from 1995 to till 2016, in this almost 20 years, it is the major period we are doing the digital transformation of healthcare. 20 years, okay? Starting from 1995 till 2016. And before that, we build the infrastructure. After that, we still working very hard. So anyway, that is the very busy time from 1995 to 2016.
Okay. So
Even
there are
today.
many opportunities for INI, for students to get involved in digital transformation in Indonesia in the next future, yeah. Okay, and the last question from Elizabeth. Maybe you can give the brief question, Elizabeth.
Okay.
Open your mic.
My name is Elizabeth from Medical Record Study Program. I want to ask about insurance. From several benefits offered by Taiwan National Health Insurance, are there any shortcomings that can make people switch to other insurance? Thank you.
Can you
You mean other
repeat your question?
insurance?
Other insurance? Do you mean the private insurance, maybe? Elizabeth?
Ya, Bu.
Maksudnya privat, maksudnya asuransi selain national insurance gitu, selain BPJS?
Dari beberapa manfaat yang udah dijelasin tadi, yang udah ditawarkan tadi sama Kesehatan Nasional Taiwan, apakah ada kekurangan yang bisa membuat masyarakat itu beralih ke asuransi lain gitu?
Oh, yeah. Is there any something not what is it? Not good, some problem in national health insurance that can make people change from national health insurance into private insurance?
Oh, you mean some other private insurance?
Yeah, is there any problem in the national health insurance service? So the people change from the national health insurance member into private health insurance.
Okay. Usually, in Taiwan, it will not really happen because okay, first of all, the national health insurance usually they have low cost. Okay, we do have a low cost for the NHI. So first of all, the satisfaction is high and the cost is low. So, so many people, I think most of the people in Taiwan, 99% will be covered by NHI. However, we do have a lot of other insurance. usually is provided by private company, which will cover diseases which is not covered by national health
by
insurance,
national health
or
insurance. Okay.
which some kind of new technology which is also not covered, new and expensive, like drugs, like procedures, which is not covered by NHI yet. We will buy that kind of national health, not private health insurance to cover that part. Just like myself, I buy a lot of it's most of it's a cancer, because new technology, the NHI will not cover new technology. So that will where we need to buy other insurance
Yeah.
also.
Yeah. Okay. Thank you, Professor, for your responses. For our wonderful students today, yeah, they're asking a lot of questions to you. And I'm sorry, the time is up, so we have to end this session. Thank you very much for your very interesting and wonderful presentation and also discussion with our students. And we know that our student will get a lot of knowledge and experiences from your explanation. And thank you on behalf of Faculty of Health Sciences. We also thank for this opportunity. And now the time for taking the appreciation, Prof. We have a certificate. Actually, digital certificate for you. We will send you email the certificate. And thank you very much, Prof. Chen Yesu, for this opportunity. Certificate presented to you as a speaker of our guest lecture in global health and environment issue at University Dian on September 24, 2024. Thank you very much. And this is the end of the session, and I will take the time to the MC. Thank you, Prof. Goodbye.
Thank you very much. Thank you
Have
very
a good
much.
day.
See you next time. See you next time.
See you next time.
Okay, see you, see you, see you.
Thank you, Professor. See you next time.
Okay. Okay.
Okay,
Bye bye,
thank you so
Annie.
much.
Bye bye, Annie.
Bye.
Yeah. Very happy to see everyone here. Okay. See you next time. See you
Okay.
next time. Bye bye.
Okay, thank you so much for Professor Chen Yeshu and also Dr. Urjana for very interesting discussion. The topic about Taiwan experience in telemedicine system and national healthcare insurance. Thank you so much, Professor, for sharing. And everyone, for the participant, before we move to the next session, I will inform you that maybe during the second session, maybe in the question and answer session later, the committee will send to you the post-test link. So everyone here is mandatory to finish the post-test so you can issue for the certificate later, okay? Okay, so for the next session, we will have Associate Professor Nuta Supakata, and she will deliver the second session about the environmental issue. And this session will be led by our moderator, Ibu Dr. Dian ST, MSI. And before we start for the second session, let me introduce our moderator. Okay, yeah. Dr. Dian is a lecturer in Environmental Health Department in Faculty of Health Science, Universitas Nuswantoro. And Dr. Dian received her doctoral degree in 2019 in Environmental Science, Department of Diponegoro University. Also, she finished her course and training in UNESCO IHE Institution for Water Education. And her field of expertise is in plastic and microplastic. She also active in an association called the International Knowledge Hub Against Plastic Pollution. Dr. Dian also the member of the Scientist Coalition for an Effective Plastics Treaty and IVA. And in 2021, Dr. Dian launched her book that summarized all of her research experience on microplastic. And Dr. Dian has a wealth of research, public services, publication, invited speakers in the field of plastic and microplastics. And recently, Dr. Dian worked with research group about biodegradation and the impact of single-use mass waste pollution in soil system. Wow. So without further ado, please welcome our moderator, Dr. Dian Khairani, ST, MSc. Good morning, Dr. Dian. Can you hear me?
Good morning, Bu Siva, Bu Ivo.
Okay. So, how are you, Dr. Dian?
Yes, I'm fine. So sorry that I make a mistake to mention another name.
Okay, hope you in a good condition. Okay, Dr. Dian, so the time and place are yours.
Okay. Thank you, my beloved MC, for giving the time to me. Good morning, everyone. Welcome to second session. My name is Dian Khairani, and I will be your moderator for the second session. We are thrilled to have you all here and look forward to an engaging and informative discussion. My voice is clear? Yeah, okay. So, before we begin, let me introduce our distinguished keynote speaker. Welcome, Dr. Nuta Supakata.
สวัสดีค่ะ
Hi,
Selamat
hello.
pagi, everybody.
Selamat pagi. Selamat pagi in Thailand. What's Thailand language? What we have to say?
สวัสดีค่ะ สวัสดี
Sawadika.
Yes. Thank you, thank you.
Thank you, Dr. Nuta. Welcome. So nice to see you joining this guest lecture. Well, in the second session, we will focus on waste management, which is very related with our study program in health environment. So we aim to such a sharing insights, discussing challenge, exploring solution, etc. Any idea, information, and issue regarding on waste. As well as we know, waste issues still in the high rank of issue blow up around the globe, especially in Indonesia. However, it's hoped that this topic will enlighten us in improving the waste management system, of course, by listening directly to the experts. But before we begin, let me skim over Dr. Nuta Supakata curriculum vitae. Okay. Dr. Nuta Supakata is Associate Professor in Institution Department of Environmental Science, Faculty of Science, Chulalongkorn University, Thailand. The education background of Dr. Nuta Supakata, she finished her master program from Computer Science and Mathematics from the Colorado School of Mines, USA, and her PhD program from Environmental Science, Kasetsart University, Thailand. Her area of research interests are waste utilization, environmental communication, and education. Her research emphasis under the waste management theme, which is currently concentrating on two major approaches, waste utilization and environmental communication and education, which is the seek to reduce waste release into the environment, add value to waste and reintegrate them into the circular economy, develop waste management models tailored to a specific area, and assist local organizations and communities in resolving waste issue for sustainability. In terms of waste utilization, her research focuses on alternative waste recycling that is based on the biocircular green. So, without further ado, I'll give the time to Dr. Nuta Supakata. Maybe are you ready to share your slide by yourself, or maybe you need some help for us?
Yes, I will share my slide by yourself. Thank you.
Okay. And then Dr. Nuta Supakata will share her thoughts about solid waste. Please, Dr. Nuta, time is yours.
Okay. Hey, selamat pagi, everybody. And I would like to thank Dr. Dian for the host of from the University of Dian, Nuswantoro University, and for your warm welcome and introduction for me. And thank you very much for having me as your guest lecturer in your international webinar. สวัสดีค่ะ everybody. So now let's start with the solid waste. But first of all, can you see this picture? This in natural world. Natural world say that it's no waste in the natural world because wastes of one organism become nutrients for others as a natural recycling of nutrients occurs. Like when someone like the leaf from the tree falling down to the ground, then the microorganism will decompose them to turn from the organic waste into inorganic waste without the food for the plants to grow. So which means that in the natural world, there's no waste at all. But in contrast, when you see this picture, you can see that from the anthropogenic activities or human activities in the modern world, we produce a huge amounts of waste that goes unused and also polluted. Yeah, that's why we're going to talk about these topics today. So let's see this picture. Can you guess what waste is the most difficult to decompose or take the longest time to decompose? Can you guess?
Plastic waste.
Yes, that's right. Plastic waste. For example, like number one, paper. It will take about maybe 2 to 5 months to decompose. And for the vegetable or the fruit peels, it will take about 6 months. But for the plastic waste, it take about more than 400 years. That's why we have like much concern about this waste because they take so long time for decompose. And so we throw away huge amounts of useful things, and we call these solid waste, which mean solid waste is the meaning or the definition is the unwanted or the something that we throw away, but we not include liquid or gas, just only solid. And we can divide the solid waste into type. First is industrial solid waste, which are produced by mines, culture, and industries that supply people with goods and services. And another one is municipal solid waste, which are solid waste that produced from our households and also the commercial activities or the workplaces. And these I will focus on only on municipal solid waste or MSW. So from this picture, can you guess how much the overall of the global populations produce of solid waste? Yes, the number is about 2.12 billion tons of waste we dump every year. And they said that 99% of these waste, of the stuff we buy is waste within only 6 months. 99% of the stuff we buy. So, and they project that in maybe 76 years ahead, all of us will throw away a waste maybe 3.4 billion tons. How you imagine this such a big number of waste? So these pictures show you that to imagine that the 2.12 billion tons of waste we throw away every year is equal to the weight of the Empire State Buildings. Do you know these buildings? It's the iconic skyscraper located in New York City. And the height of this building is about more than 400 meters with the 102 floors. So this is a big building, which means that per year, the populations, we, us, produce like approximately equal to 7,000 Empire State buildings every year. And what do we do for this waste? Do you know what are the major, oh no, before we go to what the waste go to, what's the compositions of the solid waste? Can you see the pie of this solid waste? What do you think? What are the major compositions of the solid waste?
Food waste or organic waste?
Yes, that's correct. Good answer. Yes, the majority of the components are food and green. Green is mean like agricultural waste or the gardening waste, something like that, and followed by paper, plastic, and so on. So, which mean that the big part of this waste, most of them are the food and green waste. Mhm. And what we do about this waste, how do we manage this waste? So many countries, we manage this waste by dump site or do landfill or sanitary landfill incineration and recycling. But for the next clip, I will show you how the waste will be managed by landfill. This from, the clip from the United States.
According to the EPA, the average American produces about 4 pounds of garbage per day. That's nearly 3/4 of a ton during the course of a year. The trash that doesn't get composted or recycled inevitably ends up in a landfill. The Middlesex County landfill is a 700-acre facility that sees more than 240 trucks drop their loads per day, 80% of which is household waste.
When a truck first comes into the facility, it goes through our queuing area and it's weighed at the scale facility. After that, depending on where we're dumping on any given day, it'll follow one of the haul roads up to the actual tipping area. The big misconception about landfills is that it's an open store of trash. Actually, the tipping area, which is referred to as a work face, is about 15,000 square feet. And at the end of the day, that fact will be covered. We cover that for odors, vectors, fire control, and to keep the litter from blowing around.
There was a time more than 40 years ago when open dumps had very little regulation to protect the environment. But modern landfills have come a long way since then.
Since the 1970s, environmental regulations were developed on the state and federal level to control what happens when garbage is dumped.
The key to that control is the use of a liner system.
Basically, this landfill has what they call a double composite liner. It means it has 2 liners. It has 2 synthetic liners and 2 clay liners. So the idea is as liquids collect inside the landfill and settle down on the bottom, they hit the confining layer of the lining system and they travel in this sand layer and ultimately make their way to one of our numerous leachate handling stations and are ultimately pumped over to our wastewater treatment plant in Saraville.
Environmental educator Susan Lewicki illustrates the concept using this model of a layered landfill.
I'm going to simulate a little rain by just pouring some water through the top. Inevitably, the water starts to carry all sorts of whatever's decomposing down to the bottom. The surrounding landscape does not receive the leachate. It's going to be contained within the liner.
And while leachate is contained and treated, a product of the landfill's decomposition, methane, is actually offering some benefit.
Methane is captured very simply. We just drill holes down into the landfill, and this open hole, we backfill that hole with stone, and then we put some perforated pipe down the stone. And what we've done is we created a corridor for the landfill gas to escape from outside of the landfill.
The captured methane is a viable fuel source, which is then used by the county wastewater operation.
If you can contain and treat the leachate, it's not resulting in groundwater contamination. If you can collect the methane, that can be used as a natural resource. That's positive.
I really believe that the reuse, the recycling, the reduction of waste has taken place as industries and as residents understand that they can definitely impact the amount of trash that they generate. When you put it on the curb, it just doesn't disappear. It has to go somewhere.
Okay, that's is like the common methods that we use to manage a solid waste problem, which is sanitary landfill or landfill. And now let's move to Thailand. Thailand is one of the nation of ASEAN members countries. And here, with the population is approximately 70 millions. So what we produce, this is the data from 2019. Actually, our Thai people produce solid waste approximately up to 30 million tons per year. So, but for one person, we produce like 1.1 kilograms per day. Compared to United States information that they produce approximately 4 pounds per day per person, right? And for these waste, we produce approximately 30 million tons per year. 44% will be segregated and able to recycle, and 34% is properly disposed, but for 22% is improperly disposed. What happened to these waste? Do you have any idea what's the problem that come from these waste with inappropriate disposed? Yes, first of all, they make us very messy, dirty, and they were going to be sources of disease and pathogens like flies and mosquito. And next, if we cannot collect these waste when we have heavy rains, these waste, I mean solid waste, especially plastic waste, will clog the drainage. And when the heavy rains comes, they will make the city flooding cover with the water. And from the drainage, then next, these waste will go to the canal. Every day, BMA, I mean Bangkok Metropolitan Administration, which the organization with have responsibility to manage the waste in Bangkok, they have to collect and these waste from the canal. The amount is like 150 tons per day. If we like 1 ton, one car weight of 1 ton, it means that BMA will collect the solid waste 100 cars every day, the weight of 100 cars. And most of these waste are plastic waste. Like I show you a previous slide, that why we have to concern about plastic waste, because most of organic waste take about maybe 7 days to months for biodegradable, but for plastic waste take a long time. That's why we have to concern much on plastic waste. And then from the drainage, then the waste go to the canal, and the next is to the river and to the sea, the ocean. So we found many times of garbage island in Gulf of Thailand, and this is the example. And most of these plastic waste is come from water bottle and plastic bags and so on, store and styrofoam and so on. And take a look this picture. Do you know the name of these mammals?
Dugong.
Yes, Dugong, yes. And her name is Mariam. She's died from an infection caused by the bit of plastic in her stomach. And she's just only 8 months old Dugong, and was found on the Ao Nang beach in Krabi in southern part of Thailand, maybe 8 years ago, and died in August because from an infection that was exacerbated by bits of plastic lining her stomach. Yeah, this one is the causing of from the plastic waste. And actually, like dugong, like other marine's life, for example, like a sea turtle, they cannot differentiate between the plastics from plastic waste from the jellyfish. So most of them die from eating plastic bags. And Each year in Thailand, about 400 of marine mammals die from these plastic waste. The first is turtle, sea turtle, and followed by dolphin and dugong, respectively. And also, if these plastic waste fragment from UV mechanical and microbial, they will the size between less than 5 micrometers, but bigger than 1 micrometers, we call microplastic. And these microplastics have a list to human food chain. They have many research that found these microplastics in fish as well, in oyster as well, and in the sea salt as well. And then they can come to our food chain. This is why we have to concern about these waste. And see this picture in the landfill area. With the biodegradations, both aerobic and aerobic, they will form the greenhouse gas like carbon dioxide and methane. And these are we call greenhouse gases, right? When you see on your left-hand side, in the equilibrium conditions, the greenhouse gas is good for us, like they will absorb the sun radiation and make our earth warm enough for the living thing to live. But on the other hand, from the high activities from the humans, especially fossil fuel consumption and combustion, they make a higher amount of greenhouse gas in our atmosphere. And the higher of greenhouse gases, the higher of radiation absorbed, that make our earth warmer and warmer, and leads to climate change that we can see, like we have seen like the heavy rains, especially nowadays as present in many countries, like in Thailand as well. And not only that, I say solid waste can cause fire as well. In the landfill in Thailand, every year they have like the fire maybe more than 15 times, big or small, fire in landfill. And also now let's move to Bangkok. Okay, Bangkok is the capital city of Thailand. So have you ever been to Bangkok or Thailand? Okay, in Bangkok, we have the population of 11 million people. And what do they do for this waste that we produce? So the average amount of solid waste in Bangkok per day is approximately 8,000 to 10,000 tons per day. And how we manage this waste? Actually, as I said earlier, that the BMA or Bangkok Metropolitan Administration will have responsibility for manage the waste in Bangkok. And the 80% of the waste we produce, the Bangkok can produce, we will manage by landfill, and 15% for composting, and 5% is incinerate for power generation. So in Bangkok, one Bangkokian produce approximately 2.2 kilogram per day, compared to the nation is 1.1 kilogram per day. And all right. And when we throw the waste, so what this waste go to? First, the BMA truck will come, the BMA staff will come to collect the waste from our households, and then this waste will go to the collect and transfer station. So in Bangkok, we have 3 collector and transfer stations. And from the transfer stations, what we have to do, we have to like compress the volume to reduce the volume of the waste, and then transfer or to the province, to province Nakhon Pathom and Cha Cheong Sao for to dispose of these waste to landfill. And as I say previous slide that most of solid waste will go to landfill, about 80%, and for 50% we have like the compost station in we have capacity of maybe approximately 5,000 tons per day to compost, and then for 5% we use this waste for incinerate to generate power, electricity in the power plant. And how much we spend for this waste. Only in Bangkok, can you imagine that we have to spend about 6 or 7,000 million baht, or equal to 200 million US dollars per year, only in Bangkok to manage the things that we throw away. But how we can save this money? Can you know that? So we can use or refer to the waste management hierarchy. You see this picture. The least desirable option is to dispose of this waste to landfill, right? But it's the common method that we use nowadays overall, right? But the most desirable option is to reduce. So instead of paying the things that we throw away, we can save the money by reduce is to generating less waste in everyday life, and then reuse to repairing, reconditioning device or parts of reuse, then recycle or recompose by turning the waste into a new substance or the products, and then use this waste for the energy. And the last thing that we have to use for our method to manage the waste is landfill. So first off, keep in mind that you have to reduce first, reuse, recycle. All right, and this our aim is to zero waste to landfill. And now move to Chulalongkorn University. I would like to say that Chulalongkorn University, we have like approximately 40,000 students with 8,000 staff in our university. We produce a lot of waste, right? With maybe 42 faculty, school, research institutes, and offices, and 400 academic programs, and approximately 200 buildings. So Chulalongkorn University have launched the program called July Zero Waste Project in order to reduce our waste we produce 30%. But now I would like to introduce by sharing the clip of initiate of Chulalongkorn July Zero Waste Project. Let's take a look. Just a minute.
There is no voice from this video, Dr. Nuta.
Yes, can you see the picture? Can you see the clip?
Yes, but no voice. No
voice. Ah. Sorry. Just a second.
No, it's okay.
เมื่อปี2557นะคะ
So
แล้วรัฐบาล
can
ตอน
you
ช่วง
hear
ข
the
ณะนั้น
voice?
นะคะท่านคสช.เนี่ยก็ประกาศให้ขยะเป็นวาระแห่งชาติ มีการทำรถแมพแล้วก็แผนแม่บทขยะนะคะซึ่งในแผนแม่บทขยะเนี่ยจะระบุบทบาทของมหาวิทยาลัยนะคะซึ่งสถานศึกษานะคะให้มีบทบาทในการปลูกฝังจิตสำนึกคือสร้างเยาวชนรุ่นใหม่ให้ทำเรื่องจัดการขยะได้ดีขึ้นขณะนั้นเนี่ย
You just minimize the video. Now just okay.
So what happened now?
Now it's just start from the beginning.
Okay.
ให้มีบทบาทในการปลูกฝังสำนึกคือสร้างเยาวชนรุ่นใหม่ให้ทำเรื่องจัดการขยะได้ดีขึ้นขณะนั้นเนี่ยเราก็ไม่เห็นมีองค์กรไหนลุกขึ้นมาทำตามความคาดหวังของภาครัฐในตรงนั้นแล้วเราก็เห็นว่าจุฬาเนี่ยเรามีปณิธานเป็นเสาหลักของแผ่นดินเราก็น่าจะลุกขึ้นมาทำเป็นตัวอย่างให้กับสังคมนะคะ
Dr. Suchitra Wasana Damrongdi, a researcher from the Environment Research Institute, Chulalongkorn University, tells us about how the Chula Zero Waste campaign began. The campaign is meant to sustainably manage general waste and hazardous waste within Chulalongkorn University with two main goals. The first one is quantitative. The campaign is attempting to reduce to the minimum the amount of waste that would be sent to the central system of Bangkok, setting a challenging goal to reduce the amount of waste within the campus, at least 30% within 5 years. The second goal is qualitative. The campaign aims to create a culture that makes the students and employees of the university aware of this matter. The assessment in the first 5 years, 2017 to 2021, suggests a positive result, especially in terms of the amount of waste that has been reduced by more than 30%. The plastic bags alone have been reduced by 90%, or approximately 4,700,000 bags. The amount of waste that is properly separated and managed since the beginning of the campaign amounts to 1,855 tons. This success allows the Chula Zero Waste campaign to constantly pass on the knowledge of sustainable waste management to the public sector, private sector, educational institutes, and Bangkok, whose original focus was solely on collecting waste. A team of researchers from the Environmental Research Institute, Chulalongkorn University, assisted in drafting policies and plans for sustainable waste management for Bangkok with an emphasis on waste source management, instead of only collecting it at the end of the line. Chulalongkorn University is a 105-year-old university and currently hosts more than 45,000 students and staff. Such a population comes with a lot of waste generated. However, the Chula Zero Waste campaign has been fostering the zero waste value, making everyone aware of the importance of waste reduction and sorting from the upstream. This starts from preventing waste generated by encouraging to reusable bags instead of plastic bags, and carry a personal drink container, etc. Businesses can also contribute by reducing the use of plastic bags and styrofoam food boxes. All of these are made possible by providing an environment conducive to reducing waste. Garbage bins that are convenient for sorting have been installed. Signs are posted everywhere to encourage proper sorting of waste. Activities are organized to create a Go Green community.
พอน้องๆเห็นพวกเราแยกขยะการลดขยะกันในจุฬาเนี่ยครับเวลาเขาไปทำกิจกรรมของเขาเองนะครับเขาก็จะเอาแนวทางของเราเนี่ยไปใช้นะครับเวลาไปจัดอีเวนต์ของตัวเองเนี่ยก็จะมีจุดแยกขยะแล้วก็มีทีมงานที่ไปช่วยแนะนำการแยกขยะภายในงานนะครับซึ่งเราเรียกว่า Green Mentor นะครับไปยืนหน้าถังช่วยกันแนะนำคนทิ้งขยะให้แยกขยะอย่างถูกต้องครับผมแล้วก็อีกอันหนึ่งที่น่ารักมากๆเราชื่อกิจกรรม Your Cup We Treat ครับก็คือเป็นกิจกรรมที่เราส่งเสริมให้คนพกแก้วน้ำกระบอกน้ำส่วนตัวใช่ไหมครับเรามีการกิจกรรมแจกชานม กาแฟน้ำหวานอย่างเงี้ยครับให้กับน้องๆกลุ่มที่พกแก้วมานะครับไม่ใช่น้องๆอย่างเดียวก็บุคลากรด้วยเพราะว่าผมคิดว่ามันเป็นการสร้างคอมมูนิตี้ที่ของคนสายกรีนที่ใส่ใจสิ่งแวดล้อมครับก็ได้มาพบปะเจอกันด้วยแล้วก็รู้สึกว่าการที่เราพกแก้วมาหรือกระบอกมาก็ได้เบเนฟิตได้ผลประโยชน์ด้วยนะอะไรเงี้ยครับผมว่าเป็นกิจกรรมที่น่ารักมากแล้วพอเราทำนะครับน้องๆก็บอกดีจังเลยเอาน้องๆหอพักก็ไปหยิบไปทำกันเองต่อด้วยอะไรเงี้ยครับผมว่าดีมากเลยหอพักล่าสุดก็มีแจกน้ำเหมือนกันให้กับคนพกกระบอกน้ำมาเป็นน้ำเต้าหู้แล้วก็มีแจกขนมแจกปลาต้องโกอะไรกันต่อผมว่าน่ารักมากๆครับในการที่ทำกันต่อ
Despite signs promoting waste sorting, not everyone follows the instructions and properly sorts their litter. Janitors are assigned to make sure waste is properly sorted. The janitors report that constant promotion of the campaign has improved people's behaviors regarding waste sorting. They are also proud to be a part of the campaign.
บางคนก็ทิ้งไม่ถูกที่นะคะเราก็ต้องมาคัดแยกให้ค่ะเพราะว่าบางคนขายจรอย่างเงี้ยเขาไม่รู้ค่ะเขาไม่ได้ดูป้ายใช่ไหมคะก็ไม่ถูกทิ้งไม่ถูกค่ะเราก็ต้องมาแยกให้เปลี่ยนไปมากเลยค่ะเปลี่ยนไปในทางที่ดีค่ะโครงการนี้ดีมาก
When waste sorting is done properly, it makes waste transfer easier and maximizes the use of waste. For example, food waste is sent to farms and used to make biocompost. The excess that is not sent to the farms will be processed by the university's composting machine and reused for the campus's green areas. Clean, dry waste is divided into two parts. The first part is sold for recycling. The other part is burned and converted into energy. The remainder will be properly burned or landfilled. When the source of waste is handled properly, the waste sent out will be reduced greatly, mitigating the problem of overflowing waste in the future. As for building a corporate culture to reduce waste, constant promotion and operation is needed. The results of creating a waste-reducing culture can be reflected by this student at Chulalongkorn Demonstration School, who decides to buy drinks from a shop participating in the Zero Waste Cup campaign, saying that she wants to help reduce waste as much as possible. She's aware of the impact on the environment communicated through campaigns in the school and from online media.
มีการใช้ถุงผ้าเอาไปแทนถุงพลาสติกที่แบบได้มาจากร้านแบบเนี้ยค่ะหรือไม่บางทีถ้าหนูไม่ได้เอาถุงผ้าไปก็คือจะใช้ถือกลับมาแทนถ้าอยากให้อากาศของประเทศเรามันดีขึ้นก็คืออยากจะให้ช่วยกันรณรงค์ในการใช้ถุงผ้าหรือใช้กระติกน้ำแบบเนี้ยค่ะหรือว่าถ้าสมมติว่าเราได้ถุงพลาสติกมาก็คือเอากลับมาใช้ใหม่เรื่อยๆ
Likewise, a drink vendor in the canteen who has been participating in the campaign says that the people's behavior has changed. This is evidence that such a campaign can be successful with cooperation from all parts.
ของผมนี่ถ้าเอาแก้วมาจาก20 บาทก็จะเหลือ18 บาทถ้าเอาแก้วมานี่ผมลด2 บาทเพราะว่าเราจะไปแบบหักน้ำพร้าวด้วยเข่าเลยไม่ได้ครับมันจะทำให้คนไม่อยากมาที่เราถ้าเราทำอะไรให้มันนั่นค่อยๆเป็นค่อยๆไปมันจะได้ดีเองครับแต่มันก็ผลตอบรับมันก็มาเยอะเด็กก็เอาแก้วมาเยอะซึ่งก็ดีเพราะผมประหยัดไม่ต้องซื้อแก้วราคาแพง
Since the COVID situation began to unravel, the campaign promotion has been back in action. The campaign director believes that the key factors to drive the campaign to success must come from the policy level. The Dean of Chulalongkorn University adds that the vision of the university includes sustainable development, especially the zero waste approach. This approach can make a difference in many aspects, such as for the environment, well-being, education, and poverty. Therefore, producing graduates with awareness of sustainable development will contribute to the development of the country in the future.
เราให้ความสำคัญกับเรื่องของการพัฒนาอย่างยั่งยืนมากเลยเพราะเราคิดว่าทรัพยากรที่มีคุณค่าในปัจจุบันเนี่ยถ้าเราไม่ร่วมกันดูแลแล้วก็มองไปในความยั่งยืนอนาคตมันจะไม่เหลือทรัพยากรที่มีคุณค่าให้กับลูกหลานของเราในอนาคตเพราะนั้นผมคิดว่าจุฬาลงกรณ์มหาวิทยาลัยของเราให้ความสำคัญกับเรื่องนี้มากแล้วก็เรามีหน้าที่ผลิตบัณฑิตเพื่อสังคมไทยและสังคมโลกเราก็อยากให้บัณฑิตของเรามีความตระหนักแล้วก็สำนึกถึงความสำคัญนะครับของเรื่องของ ชนรุ่นหลังต่อไปในอนาคตครับ
According to the Pollution Control Department, in 2015, Thailand generated approximately 26.85 million tons of solid waste throughout the country, an increase from the previous year. Meanwhile, sorting, reusing, or recycling has been inadequate. Challenges in promoting the campaign from now on is the communication to the target group to encourage behavioral change. The team expects that the July Zero Waste campaign will inspire the community and society to help solve this problem.
ขยะแต่ละที่ไม่ต้องจัดการเหมือนกันนะครับเพราะขยะมันไม่เหมือนกันแต่ว่าถ้าเกิดเขามีจิตสำนึกหรือมีแรงบันดาลใจในการที่จะมาช่วยกันรับผิดชอบขยะหรือว่าผลกระทบทางสิ่งแวดล้อมของตัวเองผมจะทำให้การทำงานเรื่องความยั่งยืนเนี่ยมันต่อเนื่องครับและสุดท้ายเราจะส่งมอบสิ่งแวดล้อมดีๆให้คนรุ่นต่อไปได้ครับเพราะว่ามีการสุดท้ายก็เป็นทำเรื่องความยั่งยืน
Okay, that's the case study from our July University. We call July Syllabus Project. So let me start with my latest slide. Okay. All right. So based on July Syllabus Project, we have like separate waste into 5 categories. First, food waste. What we do for the food waste is we use food waste for fertilizer by using biodigester machine, and also some food scrap we will have farmers to collect and to feed the fish. And for recycle plus, we divide into subcategories. First is the waste that can be recycled, and the second is like the waste that cannot be recycled. We use for RDF or refill in the cement plant to partially replace the coal in cement plant. And for the general waste, so we will send to landfill. And erect e-waste, so we will go to recycle or send to local government. And for infectious waste, we will send to BMA for burnt in an incinerator. And also we provide the compact machine or the compressed machine to reduce the volume that we make us to collect more waste for RDF and for the landfill as well. All right. And yes, this is a biodigester that we use for converting food waste into soil amendment that's used for plant in our university. And during we have July Syllabus Project, we can reduce more than 30% of the waste that go to landfill. So the waste that we can recycle or use as RDF in the cement clean plant, and also for the compost and feed the fish. So that, as I said, that we can reduce more than 30% to zero waste to landfill. And for the phase second for the July Syllabus waste is to encourage the students, our students and staff, to have a pro environment in reduce, reuse, and recycle waste to achieve our sustainable development goals. All right, and the slide or information from July Syllabus I have gained from Kun Kop Lim Suwan, who are the head of the environmental management work group Chulalongkorn University, who have responsibility for July Syllabus Project. And for more information, you can scan the QR code, what I'm doing in the waste management. And also, if you have any questions, you can contact me via email. And I would like to stop my presentation. Thank you very much.
Okay, thank you, Dr. Nuta Supakata, for your very comprehensive presentation and very interesting. So I can summarize a little bit from your explanations. From the beginning, actually, you say that there is no waste in natural world. Of course, if the waste can degrade by itself, by the natural way, right? And then
Okay, but the reality seems our future, the fate of the earth, we will cover by the waste, especially for the waste that dominated by unorganic waste that cannot is possible to degrade by naturally. And then about your university, anyway, I'm proven and I know well how your university well conducted for the solid waste management. And then, you know, it's such an example for us, as I know that the university also awarding for the second place of UE Green Metric, correct? So for that, we are also running go to the QS rank, so we have to prepare as well as your university can raise that rank. Okay, now let's dive right into our discussion. We have about 15 minutes for question and answer. For the participant, please raise your hand, or if you like, you also may to share your question by a chat column. Committee maybe can help me to point the participant who raised the hand. I will check also from the chat box. Okay, maybe we can start from the question from the chat box, Dr. Nuta.
All right. From your questions that seeking guidance on the least optimal approach to waste management in relation to landfill, Indonesia, there is still a significant knowledge gap regarding proper waste processing. All right. So as I mentioned in the slide that the most desirable method is to reduce, right? To reduce waste. And then to reuse and recycle. And how to say, it's easy concept, but difficult to practice in real practice, right? But first of all, the lowest cost is to give, the knowledge to people first. When like we have knowledge, for example, I teach about the impact of waste, right, through the environment. And if the students or the public know and have concern, positive, then okay, the first level is to give knowledge. Second, if they have knowledge, they will have like positive attitude. Then if they have positive attitude, next level, they have intention to change behavior. So I think the lowest cost is to give knowledge first. Education is the first choice to inculcate, to make our people have the pro environment behavior. Yes.
Yes. I don't know much about the behavior study, but somehow I see a people not always education in line with the positive behavior. What do you think? Because some educated person, but the attitude is not well impressed their education.
And also education together with the facilitator. So like the case in Jawa University, we have to provide like the media's clip or the signs or the poster to educate our students. And also we provide a facilitator like the bins, the signs with the clear, and not only at the source, but also we have to train the housekeeper who have the responsibility to collect the waste as well. And then we have provide the end pipe, like we have to okay. First of all, we ask the staff or the students to separate waste, but we have to decide when these waste have to manage or to go. For example, like we ask all the students to separate food waste. So the one thing before ask them, we have to think about where this waste should go. So we have to connect with a farmer nearby the Bangkok. And also we have to provide a biodigester to how to say, for this food waste to be composed as the soil amendment that used in the university as well. And also we asked the students or staff to separate like recycle waste and the single-use plastic waste. So we have to collaborate with cement plant to ask them to collect this waste for partially replace the coal as or we call RDF or refuse fill in the cement plants, or we ask the student to separate some kind of other waste. So we have to think about the end pipe as well. Not only at the source, but you have to like think about the source, the middle way, and the end of the waste.
Okay, so I remember one sentence from your colleagues when I visit your university. Not only about how we educate our students, how we show them the way to manage the waste, but also we have to facilitate them.
Yes, that's right.
Okay, thank you. So we move to another question. Maybe we can start from, okay, I can see here so many students very excited to give some question for you.
You are welcome.
But they are from environmental health. And some of them now running for the research, especially for plastic waste. Okay, we can start from Nila. Nila, maybe you can say what is your question you can ask.
Okay, thank you, Mom, for the time. Let me introduce myself. My name is Nila Mismaida. I'm from Environmental Health Study Program. I want to ask about what are the potential consequences of landfill fires on the environment, and can microplastic move into the air?
Yes, can you repeat your questions again? Thank you.
Okay. What are the potential consequences of landfill fires on the environment, and can microplastic move into the air?
Oh, all right. Actually, in Thailand, as I show in the slide, that we have like the fire happen average of maybe 15 times every year. This cause from because in the pile of the landfill, they have many kinds of waste, and in that pile, as I mentioned, that the major components are the food and green waste. When they biodegrade, both Arabic and anaerobic, they will cause carbon dioxide, methane, and also these methanes can cause fire, right? Because they can ignite and cause the fire. And right, and this when the fire that when these organic, both organic and inorganic fire with they combust, the outputs from this is going to be like the dust or the PM 2.5, PM 10. These that can go through the air as well and makes the air pollution as well. But go back for the decompose. The outputs from the decompose is going to be the heat, the nutrients also, and the GHG gas, for example, like carbon dioxide and methane as well. These can emit to the atmosphere, and higher and higher and bigger in the atmosphere, and this has capability to absorb the solar radiation that make our planets warmer and warmer and cause the effect of global warming. And if our Earth warmer and warmer, that make the climate change around the world. Yeah, some example.
That's clear, Mbak Nila?
Yes, thank you.
Or maybe Dr. Nuta, I thought also the fire could come from the increasing of the concentration of methane gas that produced by degradation of the organic waste in the landfill, correct?
Yes.
Yeah. Okay, now the next question is I choose a boy. Muhammad Rino Rewaldi. Okay, you can share your question.
Hello, Prof. Nuta. In my question, how does waste to energy technology play a role in more sustainable waste to waste management?
Yes. Sorry. Could you please again, please?
How does waste to energy technology play a role in more sustainable waste management?
How does
waste to energy
waste management
technology play a role in more sustainable waste management?
Oh, yeah. I got it. So he asked how waste technology can take an important role for the sustainability of the waste management.
How to say? Okay, first of all, before we use technology, we have to know first what are the characteristics of our waste. Physical, chemical, and biological. For example, like before start the Zero Waste project, we have to do the waste composition analysis. Because each type of waste have different characteristics. For example, like food waste, they can easily to biodegradable. So it can use this food waste as the compost or biogas. But in contrast with plastic waste, they have like the high heat value. So this can use them. We can use them as their RDF or refuse light fuel. So first, before we choose technology, we have to characterize our waste first. And I would like to share my idea that different community, they have unique characteristic, and how to say, higher technology maybe cannot answer our community. But first of all, we have to know our waste first before we choose the technology. Yes.
So means that we also have to recognize well our characteristic of our community. So we know which technology will suitable for them. That's correct.
For example, like if in our community, we have a lot of food waste. So incineration may be not our choice. Maybe compost can be, or biogas can be our choice instead. Or in another community, we have a lot of like plastic waste more than others. So we can maybe choose incineration or for the choice for this community.
Okay, thank you. That's clear, Mas Rino?
Yes, thank you.
Now you remember that you can synchronize the explanation from Dr. Nuta about the characterization. First, what we have to handle. Okay, so we move to Mbak Sri Hapsari. Please share your question, Mbak. Open your mic. Ya.
Ibu, saya mohon izin menyampaikan menggunakan bahasa Indonesia aja ya, Bu. Takutnya. Jadi sebelumnya penelitian saya itu kan memang terkait dengan mikroplastik. Nah, itu tentang bioremediasi mikroplastik polietilen dijadikan menggunakan spirulina. Nah, tadi kan juga sempat dibahas terkait dengan pencemaran mikroplastik di sistem perairan. Dibahas juga tentang bioakumulasi dan biomagnifikasi. Nah, tapi setelah saya melakukan penelitian Sempro ini, itu tuh banyak yang di Indonesia itu belum meneliti, tidak berani meneliti tentang bioremediasi mikroplastik. Maksudnya belum banyak artikel dari Indonesia, lebih banyak dari luar. Nah, itu menurut Prof. Nuta sendiri itu apakah teknologi ini bisa menjadi solusi yang tepat untuk menangani permasalahan mikroplastik? Karena sebenarnya bioremediasi ini kan sangat luar biasa ya Bu manfaatnya. Tapi kenapa di Indonesia ini banyak belum diteliti juga? Terima kasih.
Okay, thank you. The question from my student in Bahasa, but I will try to translate for you. Actually, she is a student who now running with her research about microplastic in marine system. And then he works with polyethylene with PA from which I call what is kind of tail for fishing. And then she now try to do kind of the bio remove this kind of the microplastic using microalgae. And then she asked about the it's possible for a bioremediation of microplastic could be a good technology that we can implement. Because you know that the bioremediation is quite a good choice for us. We know that the material to use as the bioremediator is come from the biological materials.
This question is kind of difficult for me because I'm not a specialist in microplastic, but actually I do in macroplastic, but I would like to mention that is reduce first before it's cause the impact of microplastic. So we have to like educate our people for the effect of the plastic and reduce to use them. And I would like to for the technology, I'm not, as I say that I'm not the specialist in this area, but as my King Lama Knight said, we have to choose the local technology that we can support. The good technology is local technology with low cost, and try to use local technology with adapt from the how to say the nature technology, something like that. Yeah.
I forget to explain about one part of her question. That's the technology. I said that about the bioremediation. It could be contribute for the sustainability of the waste management. What do you think that? Actually, the point of the question is that. Sorry.
You mean that what the technology?
Yeah, the technology of bioremediation contribute for the sustainability of waste management. Do you think so?
Yeah, I think so. Yes, bioremediation, as I said that, as my King Raman, I said that we have like to use local technology like biotechnology to how to say to remediate the microplastic, right? I agreed of that.
So that will be contribute also for the sustainability of waste management, right?
Right. Yes, that's right.
Okay, thank you. So I will call for Mas Ali Kam. Maybe you can share your question. We still have.
Thank you. I think waste management is an important thing to pay attention to. But I think the hardest thing is how can we tell our people that don't know about this waste management, about how can we tell to everyone about this waste management because they don't know about how important it is. So that is my question.
Yeah, thank you very much for your questions. As I tell that education is the most important factor. So we try to communicate continuously. Like July Zero Waste Project, we not only initiate or promote at the first time, but we try to communicate every semester via many kinds of media to try to reach to our students or our staff or all stakeholders that involving with waste management. Yes, continuously communication.
And maybe a little bit more, Dr. Nuta, about the strategy for the social community approach, maybe from you.
For the social, okay. In my case, in my case, okay. First of all, as I told you that we have to how to say educate them for the impact of the waste, of the solid waste, and then we try to educate them when you separate what this waste can go. So make them how to say make them have strong belief that they separate waste and this waste can go to proper management, not to mix together and go to landfill, but to make them have confidence for separating waste and make sure that these waste can go to the suitable manage. So show them, first of all, make them know the impact of the waste. As I show you the slide, what's the solid waste, what is the definition, what the impact, and make them have the positive or the awareness of the waste problem. And then educate them how to separate and show them where these separate waste go and show them. And also I have to collect the data every year for the waste that we can reduce and show the public of the how much we can reduce and how much we can reduce the impact. Yes.
Yeah, it's clear, Mas Aleka.
Okay, thank you.
Okay,
You're
thank you, Mas
welcome.
Aleka. For next, we still have 2 participants. So we will finish all these participants so they can keep their curiosity. Okay, Mas Muhammad Erlangga.
Yes.
Okay, please share your question.
Thank you, Ibu Dian. My name is Muhammad Erlangga, a student from the environmental head. I would like to ask some question to Prof. Supakata. Before that, I must say thank you for your excellent explanation of the presentation before. In here, there have been several landfill fire incidents in recent years. So many methods have been used to overcome this problem, such as covering the piles of the garbage using thick membranes and releasing the methane gas that is formed as an energy source. But my question is there any recommendation from you to overcome this problem? Because of the global warming effect itself, it is possible that in the future there will be another landfill fire incident. Thank you.
Yeah, there have a lot of incidents in Thailand as well. But as we try to promote is to reduce waste to landfill, right? From my idea, I think the most impactful effect or effective way is to reduce waste to landfill. Yes, right.
So your country also still on the way to looking for the best way to overcome this problem.
Yes, that's right. That's right.
Okay, thank you. The last question. I hope this is the last. Or maybe for other question, you can just share to the column box. Then I will send to Dr. Nutta Supakata for later give an answer. But this is the last question from Nabila Putri Nur Maulida. Please, Mbak Nabila, you can share your question.
Terima kasih, Bu. Perkenalkan, nama saya Nabila Putri Maulida dari Prodi Kesehatan Lingkungan. Saya ingin bertanya, apa sih pentingnya memisahkan memisahkan limbah berbahaya dari sampah kota di TPA itu? Sepenting apakah memisahkan limbah berbahaya itu di TPA kota, sampah kota di TPA? Terima kasih, Bu.
So, thank you, Mbak Nabila. The question is, what is a positive contribution or maybe positive impact if we separate the infectious or hazardous of waste from the general waste in our municipality that already dumped in the landfill?
So yeah, in John Conn University, we also ask our students and our staff also to separate infectious waste from other general waste. And this BMA or Bangkok Metropolitan Administration will take care of these to incineration. Because these infectious waste have to be destroyed with the higher temperature, right? So I think the most appropriate methods to manage these waste is infectious waste. So, and we have to ask, to promote and encourage all the staff and students to separate these waste as well.
Because also the negative impact of hazardous waste is different with the negative impact that could be released by the general waste, right?
Right. Okay. Waste can be separate in general waste, hazardous waste, and infectious waste, right? Infectious waste, something that can be like infect to people, but hazardous waste like e-waste, electronic waste, it's different one.
Oh, okay. That's also still separate between hazard and infectious waste. Yeah. Okay, thank you. We still have one more, Dr. Nuta Sepakata, please. One more.
Yes.
Okay. Mas Aden, you can share your question.
Hello, good afternoon. Prof. Nuta Sepakata, Televisi. Let me introduce myself. My name is Dian.
Can you just
I'm
make
from
louder your voice now? Make it louder your voice.
Hello.
Yeah. Little bit louder. Okay. Thank you.
Okay. Hello, my name is Aden from Environmental Health. By the way, I'm so amazed by Chulalongkorn University, especially its waste management program and the students' commitment to keeping their campus. Here, I would like to ask if Chulalongkorn University offers a student exchange program for international students to learn about waste management directly, perhaps a fully funded program maybe, or study tour for a week. I think it will be very interesting to learn directly at Chulalongkorn University.
Your question is, do Chulalongkorn University provide the exchange program for students in the short periods or in short periods, right? In specific topics like waste management, something like that. That I understand correct for your question?
Yes, that's correct. So he interested to join in your university as a mobility student or student exchange for the short periods. So you can explain to us some program for that. So it's looking forward for the future, for the new future.
Okay. You guys are very welcome for the exchange program, but for the information, maybe I have to ask the international affair for this information and then pass to Dr. Dian and then give to you. But because I'm very sorry because I don't have information right now about this, but I will ask the international affair for this program.
Yeah, but there is still a possibility for that, Dr. Nuta.
Or we can like do some MOU together with the Dian Nuswantoro University, and so we can develop the program like this.
Okay, thank you. Actually, that's also the question in my mind. So now just presented by my student. I never bet that he will ask about that. Okay, thank you. Thank you for all participants.
Sorry, I will ask for more information and then pass the information to Dr. Dian.
Yes. We can talk more about that later. Okay, thank you for all participants and also, of course, for Dr. Nuta Sepakata. Such a very wonderful discussion we have. And then now the time has come to express our appreciation by giving a symbolic certificate of appreciation by this Zoom room. Okay, here they are, and then I will send it by email to you, Dr. Nuta Sepakata. Again, very thank you. And then we still have so many time ahead
to can do some collaboration also with bring our student to your university, or we can share together in discussion for some topic. Thank you again for Dr. Nuta Supakata. I will give the time back to my beloved MC.
Okay, thank you so much.
You
Thank
all
you so much,
for having
Dr.
me
Nuta
as your guest
Supakata.
lecturer.
Yeah, thank
Hope to see you
you.
next time or in Thailand.
See you. Okay, see you.
You're very welcome.
My MC also has planned to visit Thailand in the short.
In the end
Maybe
of
can-
October.
Okay, you're very welcome. Okay. Thank you very much, you all.
Thank
Bye
you,
bye.
thank you.
Have
ข
a
อบ
nice
คุณ
afternoon.
ค่ะ
ขอบคุณค่ะ Thank you, thank you.
Hope I say it right. ขอบคุณครับ
Bye bye, bye bye, all students.
Bye. See you there. Thank you so much for the sharing.
Bye, sawadee krap.
Okay, maybe Dr. Nuta Supakata, are you still here? Okay. Okay, it's okay. So it's very interesting discussion about ways and the challenges. And before we end the session, I will inform you about the post test. Don't forget to finish the post test because it is a mandatory, and we can issue your certificate if you finish the pre-test and also the post test. And unfortunately, the time is too limited, but we hope we could meet in another time and opportunity. And as the MC, I would like to say thank you for our speaker and for Professor Xian Yeshu and Associate Professor Dr. Nuta Supakata for sharing the information, and also all the moderator committee for the hard work for this event, and for the participants, thanks for your enthusiasm, and also for the new students, one more time, I would like to say welcome to the Faculty of Health Science, Dian Nuswantoro University. Yay! Okay, finally, from the deepest of my heart and on behalf of the Committee of International Guest Lecture, we do apologize for any mistakes during the present of this event, and thank you for your attention. See you later and good afternoon. Wassalamualaikum warahmatullahi wabarakatuh. During the present of this event. Thank you. And thank you for your attention. See you later and good afternoon. Wassalamualaikum warahmatullahi wabarakatuh. During the present of this event.